here to help. And I also, before I start, I do want to appreciate what you said about patients really having both hospices and patients having great information. I think that that's one of the things that I really strive for and really think I struggle with when I'm talking to patients and they say what you just said, that they didn't know that, either they had some access to something with hospice or they didn't know something about eating and dying, because I find that that is really almost all the patients I talk to say they didn't know that it was legal until very recently. And there was some big poll, and over three-quarters of people recently over 65 didn't know that it was legal in the state. And so for me, that's a big issue where for access reasons, where people don't know that they have this legal right in the state. It's not for everybody. I fully acknowledge that. And, you know, not everybody's going to want it. It's not appropriate for everybody. But that so many people don't even know that they have the option to start contemplating it is really something I try to improve upon. And a lot of that is with, like you said, with hospices and services, going and talking to people. It was a big change in the law first, let's say the first of last year, but now first 2 years ago in 2022, that kind of expanded access and changed the waiting period for between visits. And just had some pretty significant changes that sometimes hospices don't even know about. So always happy to go spread some education about that. Um, in terms though of the basic qualifications, because I think that's really important. It's kind of the meat of what we're talking about. So in order to qualify for aid and dying in the state of California, and states are slightly different, but here you have to be a resident of the state. For Vermont and Oregon, they actually don't have residency requirements, but in California, you have to be a resident of the state. You have to be over the age of 18. So, any kids can't do it, not for pediatrics, it has to be adults. You have to have a terminal disease with a 6-month prognosis. So what that means is you have to have some sort of illness that doctors think will end your life in 6 months or less. And you have to have decision-making capacity. That's an important part of it. You have to be able to make your own medical decisions. And part of that is, demonstrating an understanding of, what your disease means, what it would mean to go through the process and get this medication and take the medication, sort of like showing an understanding that you kind of get what's going on. And then really lastly, you have to be able to physically take the medication. Because it's sort of what you were saying, this isn't euthanasia. This is strictly the patient. The patient is asking for this. The patient is advocating, and then the patient is actually taking it themselves. So
Mhm.
it comes in a powder, and once we mix in some liquid, you either have to be able to drink it yourself, or if you're unable to drink for whatever reason, they were able to do a rectal administration as well. But you do have to be able to self-ingest the medication. So those are really the key key qualifications.
That's really good. So thank you for clarifying that for us. And I want to unpack a couple things, or maybe there'll be offshoots of this. So I've had a patient who elected for ELOA, medical aid in dying in California. And this patient had ALS.
Hmm.
And I want to keep the details here, pretty vague. Um, but this person had obtained the medication from one physician and then did not take it for whatever reason, for which we later found out the family wasn't on board.
Hmm.
And in that delay, the medication expired and the patient lost the ability to self administer. So it was very difficult because, as you know, people with ALS, their mind is fully there, they can communicate. Um, and so this person was extremely frustrated
Hmm.
that we, well, that that it was a challenge to determine if it was going to be provided again, and all the questions, and the patient was getting worse. And so I just want people to understand that there are limitations to this, and like you said, it's not for everyone. um and on the other hand, I do have someone who was having issues with the pleural effusion. It could no longer drain. A pleural effusion